20 seconds for CDC guidelines and put on clean gloves. Hi, I'm Jessica. I'm going to be your nurse today. Can I get your name and date of birth?
Anthony Perez, 1 February 22nd, 2003.
Okay, Anthony. Do you have any allergies?
No.
No? Okay. Do you have any pain right now?
My head,
A headache? On a scale from 1 to 10, how severe is the pain?
like a 4.
A 4. And does it radiate out anywhere?
No.
Okay. Timing-wise, like does it come in the morning or
Constant.
it's constant? Is there anything that makes it better or worse?
No.
Okay. So assessing your level of consciousness, can you tell me where you are right now?
Hospital,
Okay. And today's date?
the 19th,
Okay. And the current president?
Donald Trump.
Okay. So I'm going to start by taking your vitals. So doing your blood pressure. Okay. And then taking your temperature. Okay, I'm going to take your pulse. And then as I'm taking your pulse for 1 minute, I'm also checking for respirations. Okay, and then also checking your pulse oximetry. Okay, I'm going to document that. So let me go ahead and set this up. And then I'm going to start by assessing your head. So just looking for any lumps or lesions, any surgical scarring. Okay, and then assessing in the ear, looking for any drainage, and behind the ear for any bruising. Opposite side. And then going to look up the nose, no deviated septum. Go ahead and open your mouth, stick out your tongue and say ah. Okay, and lift your tongue up, and the side, other side. Okay, no lesions. Do you wear any dentures,
No.
any hearing aids, wear any contacts?
No.
No? Okay. So I'm just gonna go ahead and pull this underneath. Look at the conjunctiva, and it's pink, which is normal. And go ahead and raise your eyebrows for me. And puff out your cheeks and smile. Okay, so cranial nerves are intact. And then I'm going to fill the carotid arteries one at a time. Okay. Then feeling for any tenderness here in the lymph nodes. And then go ahead and swallow for me. Okay, and there's no tracheal shift. Go ahead and shrug your shoulders. Okay, and then I'm gonna just go ahead and look straight ahead. Okay, both are reacting, and then follow this with your eyes, okay? Up. Okay, so next I'm going to assess your skin. So looking for any signs of dehydration by checking skin turgor, pinching, and there's no tenting. Looking just at the skin color, any bruises, scars. Okay, so now I'm going to assess the upper extremities. Feeling for temperature, any bruising, scarring, there's no IV insertions. Checking for capillary refill, which is brisk and less than 3 seconds. Checking for pulses bilaterally. Okay, and then I'm going to assess for active range of motion. So go ahead and stick your arms out, up, wiggle your fingers, back down, okay? And then go ahead and pull on my fingers. Now, push up, now down. Okay, so assessing for muscle strength or weakness. Now, I'm gonna go ahead and listen to your heart and lung sounds. So starting with your heart. Okay. So first, listening for aortic, pulmonic, Erb's point, tricuspid, mitral. Okay, now I'm going to listen for lung sound. So go ahead and take a deep breath every time I set this down, okay? Okay, so 6 on the front, and then go ahead and sit up for me. I'm going to assess lung sounds on the back. Take a deep breath every time I set this down. And then 8 breath sounds on the back on each side. And then as the back is visible, I'm also assessing for any skin breakdown here in the coccyx, and then no bruising or skin abnormalities on the back. So you can go ahead and sit back. Now I'm gonna lay this back and we're gonna take a listen to your abdomen. Do you have any history of smoking? Any recent coughs that you've had?
No.
No? Okay. So I'm going to lift this up and first inspect. So color is normal, no bruising, surgical scarring. So after inspection, I'm going to auscultate. So starting at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, so there's active bowel sounds in all 4 quadrants. Now I'm going to palpate. Any tenderness anywhere? Okay, no. Any nausea or vomiting? No? Okay. When is your last bowel movement?
This morning.
This morning, and was it normal for you?
Yes.
Okay, and when was the last time you urinated?
This afternoon.
Was that also normal?
Yes.
Okay, any problems eating or drinking?
No.
No? Okay, great. So I'm going to go ahead and move downward and check your perineal area. So if you could place your legs in the butterfly position. Okay, so checking for any tenderness. Any tenderness here? No? I'm looking for any lesions. Checking all around the skin, looking underneath. And from here I can see the rectal area. There's also no lesions or bleeding there. Okay. So you can set your legs out. Okay, so moving down to the lower extremities. Feeling for temperature, any skin breakdown, lesions. Skin feels warm, normal temperature. Feeling for any pretibial edema in both legs, which is absent. And then looking between the toes. Looking at capillary refill on both sides, which is brisk and less than 3 seconds. Looking underneath, looking at the calves for any skin breakdown, and checking bilateral pulses. Okay, and then go ahead and put your feet straight up. Do you feel any strain in your calves? Okay, feeling for any deep vein thrombosis. Okay, and then now I'm going to check your range of motion. So go ahead and put one leg up. Now switch. Then now this one outward. Now this one. Okay, and then go ahead and flex your calves and looking for the Homan sign. And then go ahead and bring your both knees towards you. Okay. And no pain there. Okay. Set this down. Okay. So now I'm going to bring this up and help you ambulate. Do you use any assistive devices to ambulate? Any canes, wheelchairs? No? Okay. So go ahead and stand up and then take 5 steps that way. So checking for his gait, balance, and 5 steps this way. Okay, so you can go ahead and have a seat. All right. So how has your stay here been?
Good.
You feel good, safe? Okay. And then how about your environment at home? Is everything good at home?
Yeah.
Safe environment? Okay. So here's your call light. Go ahead and press it if you need any assistance with anything. And then somebody would definitely be in here to help you out. Okay, is there anything else I can help you with? No? Okay. So I'm going to take my gloves off, wash my hands 20 seconds per CDC guidelines, and exit the room.